Hey guys, it's Manual Monday. Today we're going to do something a little different. We've been talking about several manipulation, mobilization, dry needling techniques over the last couple months. Today we're going to talk about, in general, how do you become a really good manual therapist. And the road to mastery in manual therapy really never ends. You should never feel comfortable with where you're at. And so we're always trying to get better, and we're believers in lifelong learning. So if you want to get really good at manual therapy, what do? The concept you need to understand with manual therapy is deliberate practice. And this is a concept that's come again and again, showing that you need to practice skills deliberately to get better with them. And so there's 5 components to deliberate practice. First of all, you need to design your practice to improve performance. You have to be intentional about what you're doing to get better at it. So if you're going to work on a CT junction manipulation, get a coworker, get a classmate. You're going to work on CT junction manipulation. You're going to focus on your hand positioning, your forces, and all the little details that go along with it. It's almost like when you're hitting a bucket of golf balls and you want to improve your golf swing. You need to think about your swing. You need to see where the ball went and figure out what happened and then correct. It's an ongoing process. So design your practice to improve performance. Secondly, it can be repeated a lot. So when we teach manual therapy courses, we do round robins so that you repeat the technique many, many times on many different people. Same thing as hitting that bucket of golf balls. You need to hit many balls practicing that same technique over and over and over. Third, feedback needs to be available. And this is really key. You need somebody to be assessing your performance in a way they can tell you what you did well and what you didn't, what you need to work on. And this is where a lot of students that come through that we see struggle a little bit with getting feedback, thinking it's criticism on their overall performance. When really, if you're good at accepting feedback, it really helps you to grow and just improve your performance on your skills. So ask your patient, ask your classmate, ask your coworker to tell you how your hands feel. Was it too aggressive? Was it too soft? Was the positioning okay? All of that feedback helps you get better at manual therapy. Fourth, it should be highly demanding. You should feel tired physically and or mentally after practicing a skill. In the case of manual therapy, when we teach manual therapy courses, typically by the end of the day, people are feeling pretty tired because they've either learned a lot of new techniques or they've been getting feedback all day practicing that skill. So we need to be putting ourselves through a highly demanding activity and stretching ourselves to get better. And lastly, it should not be very fun. So if you're on the golf course, it's much more fun to play 9 holes than it is to go to the range and hit a bucket of balls. But in reality, if you want to improve that skill, you need to make it so it's a little more boring, a little more repetitive. Another example would be shooting free throws in basketball. You need to just repeat it over and over and over. Not as fun as playing a game of pickup, but again, it helps to improve that skill. So remember, if you want to become a great manual therapist, your practice needs to be deliberate, and it needs to include these criteria. Thank you.